I'm Dr. Raina. I'm coming here from Pearl Primary Care and Health Gram, which is a service that Yancey offers to its employees and their dependents. And we are right down the street, right off of Thornton Road by the Chick-fil-A. So if you guys need a doctor, I am here for you. And I'm here to talk about men's health and what you should know as men and as women. So how is men's health different than regular health? It's not tremendously different than regular health, but men have different physiologic makeup than women. And so I can talk about women's health all day long, but I feel like we need to focus some on men. We tried to hit Men's Health Month, which was last month, but we couldn't manage to get it together in time, but we're going to do it this month. So men's health is a focus a little bit more on factors that men have to deal with, like testosterone and prostates and risk factors for cancers that women don't get, and also risk factors that everybody gets, but men have a stronger prevalence for. So briefly, we're going to talk about screenings and prevention. So the USPSTF, which is the United States Preventative Task Force, has a lot of screening guidelines for things that they want to prevent. And so we're going to briefly go over those. We're going to go over some generalized cancer screenings and then men's cancer screenings and then mental health screenings. So the USPSTF recommends screening for abdominal aortic aneurysm in all men over the age of 65 to 75 who smoke. So if you smoke, if you've ever smoked, we want to get you screened for an abdominal aortic aneurysm, which your aorta is your blood vessel that flows to the center of your body. It can get a little kind of bubble in it that can burst, which will kill you. So we want to screen you for that with an ultrasound. So if you have a risk factor for it, we want to catch you at a young enough age, early enough that we can do something about it. So if you're between the ages of 65 and 75, it's something that you want to talk to your doctor about getting checked. If you've ever smoked, if you have a history of high blood pressure or something like that. We do want to get you screened for colorectal cancer. In the last year, that the guidelines changed for screening for that. It used to be age 50. We recommended getting a colonoscopy, and it went back to age 45. So if you're 45, we want you to get checked for colorectal cancer. That's with a colonoscopy, a FIT guard, which is an annual test for blood in your stool, or a Cologuard, which is every 3-year test for gene markers for colon cancer. A colonoscopy, depending on what they find, lasts for about 10 years. But if they find something, it can be 5 years or it can be 3 years, depending on your family history. We do recommend that you get screened if you're at a higher risk population. So African-American population is a little bit higher risk for colon cancer. So we want to make sure that we get you screened a little bit earlier. If you have any family risk for colon cancer, so say your mom had colon cancer or your dad or your brother or your aunt or your uncle, grandparents, then we might want to screen you earlier. The USPSTF recommends falls prevention screening in all adults over the age of 65. So that means that, if you go to your doctor and you're 65, we talk to you about, hey, how can we prevent falls? The biggest way to prevent falls in people who don't live in nursing homes is to participate in regular exercise. So I know a lot of the guys that work at Yancey are getting regular exercise in their job, but we're talking about additional exercise on top of that. So aerobic exercise and strength training, resistance training. And it doesn't have to be for an extended period. It can be a quick 15 minutes. And it doesn't have to be every day. We do recommend every day though. Hepatitis screening. So we've heard a lot in the news about getting screened for hepatitis in people who were the baby boomer generation, but now we're recommending a hepatitis screening in all adults over the age of 18. So that's hepatitis C. Hepatitis B screening. Most of us got vaccinated for hepatitis B as children, but we do recommend a one-time screening for that. And if you are not immune to hepatitis anymore, we do recommend that you get your vaccination for that. HIV screening is also a one-time recommendation in adults if you participate in high-risk sexual behavior. So multiple sexual partners, men who have sex with men. If you participate in sex for money, then we do recommend that you get HIV screened annually, or anytime you have a new sexual partner, anytime a sexual relationship ends. High blood pressure screening. So we want to screen people at every visit that they see their doctor for, but anything of a Any blood pressures above 120/80 is considered abnormal. And we want to catch that early, because if we treat it early, then we can prevent things like heart attacks and strokes and things in the long term, that abdominal aortic aneurysm and death. So we're trying to prevent death there. Lung cancer screening. So that's with a low dose lung CT. And you would get that every year if you are a smoker and you have more than a 20-pack year history and you're above the age of, I want to get my ages right here, above the age of 50. So between ages 50 and 80, if you have smoked more than 20 years of your life, then we want to get you screened. And if you stop smoking sometime less than 15 years ago. So once you've quit smoking for 15 years, so let's say you're 50 now, but you stopped smoking when you were 30 and you haven't smoked since then, we don't need to screen you. But if you stop smoking when you are 45, we need to wait until you've hit that 15-year mark before we quit screening. Diabetes screening, that is something that we've talked about the last time I came. We talked pretty heavily about diabetes and screening, but if you're above the age of 35, if you have any risk factors, so such as overweight or obesity, you have family history, then we want to screen you for diabetes. I know that when you get your annual labs here at Yancey, they're checking your A1C and your cholesterol, so they're taking care of that. If it's abnormal in any way, shape, or form, come see us. We'll take care of you. You can go to your regular primary care doctor as well. A depression screening, it is recommended by the USPSTF that every visit get screened for depression. That's asking some basic questions by your doctor or filling out something called a PHQ-2, which is a basic one. Are you feeling down or depressed? Do you have loss of hope? And if you have any of those things, then you want to let your doctor know, because those are big modifiable risk factors for things down the road. We do want to screen everybody for tobacco use and talk to them if they do use tobacco and say, hey, you know what? There's a lot of things that we can prevent if you stop smoking, or even just decrease the amount of smoking that you do. And that includes vaping. I know that that's been more prevalent, and using things that you smoke that may not be tobacco. So I want you to kind of quit all those smoking behaviors or things that can injure your lungs. There are other less noxious ways to obtain nicotine if you have a nicotine habit. So nicotine gum, nicotine patches, so other ways to obtain that aren't vaping and smoking that hurt your lungs. We do want to screen for unhealthy alcohol and drug use. So the recommended maximum daily use of alcohol is about 2 drinks for guys and 1 drink for women. And that's 1 beer, that's 4 ounces of wine or 1 shot. So not a glass of wine, or, when you get, this idea that a glass of wine is about a half a bottle is not actually a healthy use of alcohol. But it's 1 to 2 is a reasonable amount. Anytime that you're drinking 6 or more alcoholic beverages at one sitting, that's considered binge drinking. So if you're spending your weekends drinking a 6-pack at one sitting, or a 12-pack, or a 5th, then that's probably too much, and you should talk to your doctor about that. There are other ways to deal with life than having to drink that much. We do want to screen for drug use as well. So marijuana is kind of a socially acceptable drug. I don't know what the policy is at Yancey, but probably not an acceptable use if you are operating heavy machinery or participating in Yancey's insurance program. But that being said, marijuana use can be unhealthy. LSD use is probably always unhealthy, and things like cocaine and utilizing methamphetamines, those sorts of things, and prescription drug use. So sometimes we think that, okay, well, my doctor wrote me for this medication, so it's not bad for me, but it can be, over the long term, not necessarily a great thing for your body. So we want to make sure that what you're using is healthy for you. We do want to screen for obesity, be able to prevent it and treat it. So again, this starts at a young age, but it's very important in healthy adults that we check. So you can be healthy at any size. Your weight does not indicate what your health is, but we have found that people who have a BMI over 30 have a higher likelihood of developing some cancers, diabetes, high blood pressure, and high cholesterol. Also pretty important is screening for STDs. So making sure that when you talk to your doctor, you're frank with them about your sexual practices. So if you participate in anal receptive intercourse, you need to let your doctor know. If you're not using condoms, you need to let your doctor know. If you have multiple sex partners, you need to let your doctor know. Because there are things that we need to screen for more readily and places that we need to screen your body for more readily than if you just are not forthcoming about your sexual practices. So nobody's going to judge you. Nobody's going to say anything, especially if you come see me. I'm happy to take care of you. I just want to make sure that we get the best care. And so STD screening would be if you participate in any high risk sexual behavior, anytime a sexual relationship ends and prior to beginning a new sexual relationship with someone. We want to make sure everything is good to go. So that's all screening stuff, which is a vast majority of our preventive health care. Now we want to make sure that we take care of screening for specific male cancers. So I get a lot of guys that come in and want their PSA checked, and expecting when they get a physical exam that we're going to do, we call it the ER handshake. So getting a digital rectal exam. That's not as recommended as much anymore. So there have been changes in the last probably 10 years about screening for cancer. We used to do pap smears in women every single year, starting from the age of 16. And we used to do digital rectal exams in men anytime they came to the doctor after the age of 40. And sometimes when you came for a sports physical, you even got one. But we're not recommending that as much anymore because we found that both of those cancers grow very slowly. There's not a reason necessarily to do it as often. Now, if you're having symptoms like you're not able to pee as well as you used to, you're going to the bathroom in the middle of the night 4 to 5 times, you start to pee and all you get is a little dribble and then it's not coming out like it should, that sort of thing, then you need to let your doctor know, and you may need to get a digital rectal exam at that point to make sure that you don't have prostate cancer or an enlarged prostate. But in general, the American Urologic Society and the American Urologic Academy say that a digital rectal exam is no longer indicated, but a prostate-specific antigen is the screening tool for prostate cancer. Now, that being said, getting a baseline prostate antigen is reasonable, a PSA, but it's not necessarily required. So we have found that people tend to die with prostate cancer, not from prostate cancer. And the treatment for prostate cancer can be pretty intense. So talking with your doctor about what your goals are in life and what you want and what your family history is prior to jumping on screening for something like this. It usually starts at age 40 and you want to get your prostate checked after you talk to your doctor and talked about your risk factors. And then you would check that every 3 to 5 years, depending on how things go. Screening for testicular cancer, there's not a great screening recommendation for that. It is something that if you notice something on your testicles and you've done an exam and something's off, then you need to go to your doctor. But testicular cancer usually occurs in men under the age of 40. It can occur in men that are older, but usually it's in younger population. So if you're a younger guy and you notice all of a sudden you're taking a shower and something's not right, then don't ignore it. If you notice a hard lump or something that feels like a pebble inside your scrotum, or one of your testicles is suddenly riding higher than it used to ride, then you need to go to your doctor and let them check that out. As far as other cancer screenings, we talked about colorectal cancer, we talked about lung cancer screening, skin cancer screening. So if you notice something on your skin, you need to get it checked out. Especially if you're above the age of 40 and you are fair skinned and you have had sun exposure through your life. A lot of times in guys, it happens on your ears, happens on your nose, happens on the top of your head if you have less hair than other people, and it happens on the arms, especially your left arm, because you tend to drive and have your arm up in the window, and so you get more sun exposure on your arm. It can happen on legs. It doesn't happen as often for guys on their legs, but usually face and sun exposed areas. So your neck, your ears, especially scalp, arm. Men can get breast cancer. So if you notice a lump in your chest that didn't belong there, If you have a family history of breast cancer that's very strong, if you have a male relative who had breast cancer and you find something, you need to let your doctor know. Again, that's something that might be in your chest area that feels like a P, or something that doesn't belong there, or you get swelling in your underarms, then definitely let your doctor check that out. So screening for mental health. This is something that often as men, it's not talked about very often. But if you go to your doctor, you should be getting screened for depression and anxiety. So if you're not sleeping well, if you're feeling fatigued, if you feel off, if you're feeling hopeless or you're feeling down, then these are things that you need to express to your physician and not just ignore. Since COVID, there has been a massive rise in people with depression and anxiety, especially with the way the economy is going and the way people are seeing a lot of changes in the world. And it's not a sign of weakness to have depression, and it's not a sign of weakness to have anxiety, but it's something that needs to be dealt with and not ignored. I think that unfortunately, culturally in the United States, we've been taught to kind of push all that down and keep going, keep trucking through. But it can be very detrimental to your health if you don't deal with it. If you're feeling like you want to harm yourself or harm anyone else, that's something that needs to be dealt with immediately. So the screening and treatment options for these are very similar. And if you go to your doctor and you say, I'm feeling down and depressed, then they're going to have you fill out a little piece of paper that's called a PHQ-9, which I'll show you later in the presentation. If you say, I'm feeling anxious, then they'll have you fill out what's called a GAD-7. And you may fill out both, because anxiety and depression tend to run hand in hand. So again, some of the symptoms of depression are feeling hopeless, having a loss of self-worth, feeling like you're fatigued and not having any motivation. Not being able to focus at work can be a symptom of depression as well. Sleeping too much or too little can be a symptom of depression. Anxiety can tend to run as a feeling of pressure or a feeling of doom. You can get palpitations, you can stop sleeping, you can sleep too much, again with anxiety. And one big one for depression and anxiety is attitude changes. So suddenly you're snappy with people that you weren't snappy with, or you get frustrated with your kids or your spouse or the dog or whatever. That can be a symptom of those things. And screening and then treatment. So we will talk about treatment briefly here, but treatment options, you can do medications, but you can also do therapy. You can do meditation. You can do lifestyle modifications as well, like exercise and changing your diet, making sure you're getting adequate sleep and treating things for those. So that's screening. That was a lot to talk about screening, but that's prevention. So a lot of health is preventing. So we love to treat things, but I'd love to prevent it before it happens. So I'm going to talk briefly about testosterone, because I think that that's very important to men's health. And I get a lot of questions about testosterone and where people's testosterone is and how it's regulated and why did it get low and is this the problem? But I do want to say that if you have low testosterone and you're not symptomatic, it doesn't really matter. If you have a bunch of symptoms and your testosterone is normal, it's probably not your testosterone. But if you have both hand in hand, then we can help fix that. Some of the symptoms, and this is a very long list and probably mirrors a lot of other things, but you can have reduced energy and endurance. So suddenly you're just not feeling like yourself. You used to be able to perform at work in a way that you can't perform anymore. You start losing your body hair or get a patchy beard or mustache that suddenly was not normal for you. Not so much the head hair, that, sorry guys, is not affected by anything I can fix. So it just is. Fatigue, having reduced muscle mass. So you used to have a lot more bulk, but now you have less. Obesity can be a symptom of testosterone, low testosterone, and it can be a cause of low testosterone. Those depressive symptoms, like we talked about, reduced cognition, reduced motivation, just feeling like you can't do the things that you used to do, poor concentration, poor memory, getting irritable, reduced libido, and erectile dysfunction. Again, some of these can be caused by low testosterone. Some of them can be caused by depression. Some of them can be caused by hypertension. Some of them can be caused by any number of things. And just chronic stress that hasn't led to depression can cause a lot of these things. But these are your basic symptoms. And it's never wrong to go to your doctor and say, I'm having these symptoms. And if they say, oh, I think you're fine, you can always say, can you check my testosterone? I'd like to make sure. But knowing that that might not be the panacea to fix all of these issues. So knowing you have those symptoms and then coming in and getting lab studies. So just because you have those symptoms doesn't mean you have to get treated. But we want to check your early morning testosterone. So checking your testosterone at 4 o'clock in the afternoon isn't going to give you a great reading. You need to get it first thing in the morning. So not necessarily first thing when you wake up, because a lot of you guys get up at 4 o'clock in the morning, but first thing, you know, when the lab opens or when the clinic opens or when your doctor's open, but sometime between 8 and 9 a.m. is an early morning testosterone, but not 2 o'clock in the afternoon after you've had lunch and you've been working all day. You're bound to have a little bit lower level at that point because testosterone goes up and then it goes down and then goes up and down throughout the day. If it's low, so that means your testosterone, a normal physiologic range of testosterone can be anywhere from 250 to 800. Okay. And that varies as you age and it varies about who you are as a person. So some people tend to have higher testosterone naturally, and some people tend to have lower testosterone naturally, which is why if you just get tested for testosterone, you're not having symptoms, your testosterone's 350. Then we go, oh, you know, like that is what it is. That may be who you are as a person, which is very similar for when women get tested for estrogen and progestin. So the range is really high. Also, if you're in your 70s, you probably don't need a testosterone at 800. That might not be so great for you. But having a testosterone someplace between 300 and 600 is still considered normal. If you're 25 and your testosterone is 250, that might not be great, that you may need to have it increased a little bit. But you want to get your first early morning testosterone. If it's under 300, we want to repeat it in a couple of days to weeks and see. Because if you were sick or you didn't, you know, sleep well the night before, or you'd exercise more than normal, or any number of things can affect your testosterone levels. So we check it again. So just make sure. Once we've checked it the second time, if it's still low, what we'll get is a luteinizing hormone, which is called LH, is those are the initials. We check that to figure out why your testosterone is low. So your testosterone comes from your testicles, but also it's initiated through your pituitary gland in your brain. So if your LH is low, then we need to figure out, okay, is it your testicles that are the problem or is it your brain that's the problem? And so once we figure that out, then we can decide, okay, if it's your brain that's the problem, then we need to check on a prolactin, which is another hormone released by your pituitary gland. If your LH is normal, then we go, okay, well, your testicles might not be functioning as they should. Then we're going to get a complete blood count, which checks for your hemoglobin and hematocrit, which are the pieces of your blood that transport oxygen in your red blood cells. We want to make sure it's not super duper high, because if we need to treat you with testosterone, then that can increase. And we need to get your PSA checked, because we want to make sure if we're going to give you testosterone, that we're not going to increase your prostate size and that you don't have prostate cancer, because it can predispose you to that. So once we decide, okay, your testosterone is low, what do we need to do? We need to treat you if you want it. Again, not everybody has to be treated, but if you choose to be treated, you can be. And there are two recognized methods for that. One is androgel, or a testosterone cream, and the other is a testosterone injection. There are testosterone pellets. Those are not as well studied. Those are more long-term. And then there is a testosterone injection you do every 12 weeks. I don't really recommend that as much because it doesn't give you a nice steady state. You have a decrease around 10 weeks and then you kind of feel like trash, and then you wait for your other 2 weeks and you get your testosterone. So once you've been on that, you want to repeat your labs to make sure we're actually doing something. So if you're on testosterone injection or the cream, you should be getting labs every 3 to 6 months. And it's not something that you just go, well, I'm just taking all this testosterone and I don't know if it's fixing anything or doing anything. You want to make sure that you're actually treating it appropriately. So again, treatment options. And by the way, this is a testosterone molecule, this for everybody's organic chemistry love. So treatment options, again, cream or injections or pellets. There is an intranasal testosterone. We rarely use that, and oftentimes it's not super available. And then there is a compounding option where you go to a pharmacy and they mix it all up for you and put it in a cream. Compounding pharmacies are not regulated by the FDA. They're regulated by a state board, a state pharmacy board. The creams that are commercially available and the injections that are commercially available are regulated by the FDA. So you know every time you're getting exactly the same amount. If you get a compounded cream, you may be getting a lot, you may be getting a little, you don't know. That being said, if you're using a cream, make sure that you put it on an area that won't be exposed to your female significant other or your children. So you don't want to give your little kids testosterone. So if you're putting it on your legs, you don't want to put your child, on your lap right afterwards. So avoiding skin to skin contact before washing it off. So usually it's axillary, thighs, or your back. So you want to kind of focus on those areas and making sure you don't put that directly on somebody else who shouldn't be getting high levels of testosterone. You may have any questions about testosterone. So when you're taking it, you're still going to get those ebbs and flows a bit. But if you feel like your symptoms are not better and you've been on your testosterone supplements for 3 months, then it may not be good for you. You may need to try something different, and it may not be the cause of your symptoms. Also, knowing if you get too high. So I was in the military. I treated a lot of guys with testosterone, and sometimes you notice like they're getting a little ragey. I feel like maybe we need to check it. And their testosterone's 900 and they've like pounded the door in. You need to be willing to back off and realize that you may feel better, but it may not be right for you. You may need to come down or go up depending on how you're feeling. Chronic illnesses. We have beat a dead horse about chronic illnesses. I know that all of you are aware of kind of your big chronic illnesses, but these are things that really affect men and oftentimes affect men later. So women are more apt to go to the doctor initially, and men are more apt to limp through their 30s and 40s and get into their 50s and then show up at the doctor with all this stuff and then go, oh no, what do I do? Versus we can take care of it better if you're in your 30s or even your 20s, and then we're not ignoring it and kicking the can down the road. So, high blood pressure. Brittany has a program here where you can go in and get your blood pressure checked. If your blood pressure is over 130 over 90, then you need to do something about that. You don't need to ignore it. You don't need to say, oh, my mom has high blood pressure, I'll be fine. Because over time, you're hurting your kidneys. You're hurting your blood vessels. You're hurting your heart. You can get an enlarged heart. You can get kidney damage, and you can get a lot of blood vessel issues where they get tighter or thicker, and then you can end up with a stroke or a heart attack or any number of things, erectile dysfunction, all sorts of fun stuff. So making sure that we try to treat your blood pressure early and not necessarily with pills. I'm not going to push pills on people, but if you need them, then we'll take care of it. But there are a lot of different ways to deal with it. But if you don't know, you can't take care of it. So I would suggest going to your screening visits and or going to your regular doctor's appointments at least annually to get that checked. High cholesterol, Yancey offers a program every year where you can get your cholesterol checked. If it's high, do something about it. Don't ignore it. Don't put your head in the sand and pretend it will go away, because it will not. Especially if you have a history of high blood pressure or everybody in your family's had high blood pressure. Don't ignore it. Don't say, well, everybody's got it, I guess I'll just be just like everybody else. It doesn't have to be like that. You don't have to give up, but also you don't have to pretend it doesn't exist. Sleep apnea is a big health issue in our community, and especially amongst males. They can give you the same symptoms as depression. And if you have untreated sleep apnea, you're more likely to have high blood pressure, high cholesterol, and diabetes. So we can actually treat your sleep apnea, and that may help your blood pressure and help your cholesterol and help your depression. So getting checked out with a sleep study is ideal to make sure. If your partner complains about you snoring, maybe don't ignore her about that. Maybe go to the doctor and get checked out, because you will feel better if you get treated appropriately. And it doesn't necessarily have to be a CPAP. The nice thing is they don't make you sound like Darth Vader anymore. They're not massive masks anymore. They're tiny and you can take them with you on trips, and they've got all sorts of different masks. So if you have a beard and it doesn't fit and you're like, I can't do this, then go back and get a different one. They've got nose ones, they've got mouth ones, they've got nose and mouth ones, they've got little teeny nose ones. There's a lot of different options for treatment for sleep apnea. If you don't tolerate a CPAP, that's fine. We can send you to a dentist to get a mouth guard so it pulls your jaw open so that you're not snoring as much. And it's not necessarily the snoring that's the problem, it's stopping breathing that's the problem. So you can snore all the time, but if you're not breathing, that's an issue. So we need to make sure that we're addressing that. Metabolic syndrome and diabetes, we've talked about previously, but getting your hemoglobin A1C checked, which is something that Yancey does in their labs in the fall. If you have overweight, which is a BMI above 25 to 30, or obesity, which is a BMI above 30, then you need to get checked for diabetes. And if you have high blood pressure and high cholesterol, you need to get checked for diabetes because you're predisposed to getting that. It's something that can be treated to start with without medication. And as we progress down the line, maybe you need medication, maybe you don't. But it is a reversible condition initially. If you ignore your body, then we can't take care of it. So if you'll come in earlier, then we can take care of it and potentially prevent you from being on medication for the rest of your life. All right, so last part is mental health and lifestyle changes. So we talked about anxiety and depression quite a bit. I am bringing it up again because when I asked people, again, I'm a woman and I have mostly female friends, but there are some men, but all of them said, talk about anxiety and depression, because I think that there's a lot of stigma about mental health, especially amongst men. It is not weakness and it is not a moral failure that you have anxiety or depression. But if you ignore it, that is a failure. So you need to deal with it. You need to address it. And the way to address it is not just to take pills. It's not just to, check yourself into a psych facility or any number of things. And it doesn't mean that you're a bad person. It doesn't mean you're a bad dad or a bad father, husband or a bad boyfriend or any of those things. But we want to make sure that we get you to be the best version of yourself that you can be. So these are the screening tools I talked about briefly earlier, the GAD-7s for anxiety. And again, if you guys can see it, many of us have dealt with these things previously. So it's not something that you think, oh my gosh, this is way out of line. These are normal behaviors that have become abnormal. So people get restless and have trouble relaxing, but if it's becoming intrusive and now you spent the last 8 days out of the last 2 weeks not being able to just sit or think about things, and you're not sleeping and you're having these intrusive thoughts, then that is when it's become a problem. The first two, the little interest or pleasure in doing things and the feeling down, depressed, or hopeless in your PHQ-9, those are our initial screening questions. If you answer yes to those things, you're probably going to need to answer the full PHQ-9. So treatments include medications. There are a lot of different medications, and there are a lot of different mechanisms of actions for those medications, but there are a lot of options now. 30 years ago, there was nothing. So legitimately nothing. Prozac came out about 30 years ago, and that's when our first stuff happened. They used to give you lithium and check you in the hospital and do a lobotomy or electronic or ECT, which is electroconvulsive therapy. That was all we had. And so now in the last 30 years, we've made massive improvements in mental health treatments with medications. That being said, the biggest treatment for anxiety and depression is to talk to somebody who's a trained therapist and get some cognitive behavioral treatment. So learning how to reframe and learning how to deal with some of these things. You can't change your situations all the time, but you can change how you view your situations. So getting cognitive behavioral treatment, and also exercise, lifestyle changes, getting adequate sleep. There's a new reel going around on social media that says, oh, I wish I could get 8 hours of sleep. And the person responds like, So why don't you go to bed 8 hours prior to when you need to wake up? And they're like, no, that would never work for me. But you need to plan your life. So you plan when you're going to leave your house to get to work on time. So why not plan backwards? Okay, I don't do well when I get 5 hours of sleep. Maybe I need to get 6. Let's plan for 6. And having the freedom and boundaries to say to people, maybe not the workplace, but maybe socializing activities, but like, I can't be there for that. I can't be there for this until I take care of this part of me. And learning that that's okay. So goals for treatment of anxiety and depression is to make it where it's not intrusive in your life so you can continue with what you need to do. It's probably never going to be gone entirely, but it's going to be manageable and something that you can tolerate. So knowing that sometimes, yes, anxiety and depression goes away entirely. Sometimes you have a really terrible situation, you know, somebody significant to you passes away and then you lose your job and then the car payment's due and you can't make it. Like, okay, like I get it. That's a big situation that you've got going on there. But then sometimes it's just life is hard and we need help. All right. And then talking about lifestyle interventions. So next steps. I put a puppy because they make everybody feel better. But get your physical, go to your doctor. You don't have to go all the time, but at least, you know, once a year is very reasonable. Don't be the dude that is, you know, 45 and hasn't been to the doctor since he was 20 when he got off his parents' health insurance. And then suddenly you've got all these things that could have been taken care of. You have access. We are here at Pearl Primary Care. You have access through your insurance company. You have access to care. We do not live in Zambia. You have access. So go to the doctor, get your physical. Don't utilize urgent care as your only primary care. It does not work that way. They're not going to be able to take care of you in a way that's good for your health in the long term. So just go. Exercise. I'm not saying go hit the gym for an hour a day. That is not feasible for most people. But getting up and moving, I know you guys are doing a step challenge. And I know somebody is potentially going to win that step challenge, Mr. Helke, but if you can get in just 10 to 15 minutes of exercise a day, and I'm not talking about like massive, I have to lift these, you know, huge weights, but getting in some strength training or resistance training for 10 to 15 minutes a day is adequate to prevent a lot of long-term complications. Aiming to sleep an adequate amount. Not everybody sleeps for 8 hours a night. Not everybody sleeps for 9. Not everybody sleeps for 4. You know where you need to be. And if you're waking up and you're feeling tired, you probably need to sleep more. If you wake up and feel well rested, great, you're on the right track. If you can't sleep and you need help, then go see your doctor. We can help you. Eating better. So that is talked about all the time, and I think we all have some idea of what we should be eating. It's expensive to eat really healthy, but it's not impossible. Avoiding highly processed foods, sticking it out with vegetables and fruits and frozen things and canned things. Those are okay. It's fine to eat, you know, canned green beans because at least you're getting some fiber and you're getting some vitamins. You don't have to go get a fruit kale salad. That may not be the answer for you. Some people don't like kale. I don't like kale. I think it's gross. But you know, if I'm going to eat, you need to pick options that are healthier for you. Grabbing a granola bar is quick and easy, but it might not be the best option for you when you could grab an apple or a banana. I know that those things go bad really quickly in your house, but yeah, sticking for whole foods versus super processed foods. So, you know, if you're going to have coffee creamer, have actual coffee creamer. Don't drink the stuff that's powdered because that's not real. Like it's not real stuff. So try to aim for real things. If you have diabetes, you need to avoid sugar. I talked about before, I had to drop sweet tea from my diet because it really jacked up my A1C. So when I dropped it out, it really made a big difference. So just doing that, small things can make a big difference. Drinking water is very important. I know that's something that your mama probably told you when you were a little kid. But 8 ounce glasses of water is the recommendation. If you are drinking water only filtered through coffee beans, it's probably not great. You need something liquid that doesn't have caffeine in it, a diuretic, that sort of thing. Soda is, again, people drink what they want to drink, but try to add in a bottle of water a day if you're usually a Mountain Dew drinker. Just one. I will tolerate even a little 8-ounce bottle, just something to flush those kidneys out, okay? We do want to talk about tobacco cessation, decreased alcohol intake. Again, everybody can do their own thing, but if you're drinking a lot, then you need to think about that and potentially get help to decrease that amount. And look at why you might be drinking as much as you're drinking. Tobacco cessation, again, we've been pushing for that for years and years and years and years. And I know that some people are not willing or ready or able to quit smoking entirely, but even just cutting back can help improve your lung function. Stress reduction, meditation helps. Eliminating stressful situations that you don't have to be in. If you find yourself always arguing with your father, maybe just don't engage anymore. If you find yourself always arguing, over things, or you're showing up to work late, or you've got this extra stress financially, then try to find one small thing you can do during the day to reduce that overall stress. You may not be able to reduce everything entirely, but there are small things that you can do in your life that will reduce it. Just like, when it was just me. When I was little, I was always running late in the morning. So I used to sleep in the clothes I was going to wear out the door, because I knew that I would save myself some time and I could sleep for an extra 5 minutes if I went ahead and got my outfit on before I left. But things that are small that you can do. So making sure your car is filled up with gas before you go home, so that you're not in the morning going, oh my gosh, I don't have gas in my car. Take your medicine. If you're prescribed medication, take it. If you don't want to take it, tell your doctor you don't want to take it. Instead of them coming in and being like, so you're taking your blood pressure medicine? Yes, I am. You're about to get another one, because it doesn't look like you're taking it. So if you have medication, take it. If you have a supplement you're taking, take it. If it's not working, tell your doctor. If you don't like the way it makes you feel, tell your doctor. Medication actually can help decrease blood pressure. It can help you decrease your stress level. It can improve depression. It can improve anxiety. It can improve overall cognition, so you can actually remember things that people tell you to do. So taking time, and it doesn't have to be every day, but there are a lot of guided meditation apps out there now. Headspace, Blend, I think, and there's one called Abide if you want a more religious aspect. If you want, there's a lot of options for you that will take you through a 3-minute, 5-minute. You can use your Apple Watch, will tell you to take a breather break. My Fitbit tells me I can take a breather. Just using that time, and it can legitimately be 30 to 60 seconds to just regroup. There are guided breathing exercises that you can do that actually reduce your blood pressure, so you may not need as much blood pressure medication. And then being kind to other people. So I know that kind of is something that sounds very trite, but if you're kind to people, then your whole outlook changes. So I hope that this was helpful, and we are available. Shakondra, who's here with me, and myself, we're available right over on Thornton Road, and we're happy to take care of you guys anytime. And this is, I know, men focused, but also, we take care of women and men, spouses, and employees. So we are happy to see you anytime. And that's all I've got.
Any questions on the room?
I don't see anything on the channel.
Okay.
Medications, you see, on TV, you see so many medications. This is good for this, good for that. But then there's like a half a dozen other things where you're going to be going a third. We have something wrong.
Right.
I mean,
Yes.
Start to feel pain, having a feel. I mean, you just don't know what to say.
Right. So sometimes, well, first off, pharmaceutical companies are not bad. They do put a lot of effort and energy into new medications, and those new medications have a lot of money involved in them. So there's a lot of marketing involved. Sometimes newer isn't always better, and sometimes it is. But if you see a medication and you think, maybe this will help me, Probably don't just Google it because you're just gonna get the same information that the ad gave you. But talking to your physician or talking to, you can actually go on the drug company's website usually and get a little bit more information. But they are required to now say those side effects. I will tell you that if Tylenol had to go through the same FDA approval that the medications have to go through now, it would not be approved because of side effects. It would have a list of side effects like this. None of that includes growing an extra limb, but, you know, hepatic liver failure and skin changes and headaches and rebound pain, all of those things would be listed, nausea, vomiting, blah, blah, blah. So nothing that you put in your body is completely without side effects, and we want there to be some side effects, right? So we want the side effect to be that your blood pressure is lowered, or your erectile dysfunction's fixed, or your cholesterol is lowered. And so those are side effects of the active ingredients.
So like, they had the good side effects, but I was on statins because I had a stents.
Right,
I mean, I cycle, I swim.
Right.
But doctor put me on statins.
mhm,
I don't want to take them for feeling because of literally the side effects of those things were
right.
it's like, hey, I'm not having a heart attack.
It's, yes, and there are massive things. The thing is about that is there's something called shared decision making. So it's big in the medical community now. It wasn't 20 years ago. You used to go to the doctor 20 years ago and they'd say, do this. I'm telling you to do this because I'm the doctor. Now you have something called shared decision making. So you come in and you say, Doc, this makes me feel like trash. I don't want to take it. And they go, oh, okay, well, maybe we can find an alternative. Or maybe you don't take it for now, or maybe you do a drug holiday. So you take it for 2 months and then you don't take it for 2 months. And we try to prevent things down the road. But again, you know, you had medical condition that was very likely genetic for you, that you couldn't do anything about. But I will say that I often tell people, I don't live in your body. I can tell you what my research shows you. I can tell you what the generalized, you know, the generally accepted things to do are, but I'm not with you. I don't know. If you don't feel good on this, you got to tell me, because I'm going to keep giving you stuff until you tell me no, or until you say I feel better, or any number of things. But I'm going to try to work with you, but I'm not with you. So, you know, if I say take 3 pills a day and you're like, I can take 1 pill a day. I can't take 3 pills a day. I'm out in the shop and, you know, I don't know what my lunch break's going to be. But if you don't tell me, I don't know. I know what my life is. I don't know what yours is. So if you're having side effects, just talk to your doctor, talk to whoever's giving them to you so they can make it work for you guys. I can't speak for all doctors. I speak for myself. I want to work with people to help them feel better and to do better and to live longer, healthier. I don't want you living longer as a vegetable on a, respirator. That's no fun. But living longer healthy. I don't want to add a burden to people. I want them to feel better and to be able to do the things that we want together. So it's kind of what you're doing, because I only know what I do. And so I can take a pill at lunchtime because I'm going to eat lunch. But, you know, if you're in the shop, you might not be able to. So, yeah, I would say just be as honest as you can with whomever you're seeing and is prescribing your medications.
All right, well,
Come on over.
Thank you very much, everybody, for jumping on our health break.
Yeah.
And I need to move over. That is it. Thank you. I think we are about a minute over time. We're right on time. So thank you very much. And this recording will be available later.
If you have any questions, give us a call.